Today we're going to be talking about injuries to the anterior cruciate ligament, or ACL. Essentially, when we look at a model of a knee, we have the two bones. We have the bone above, which is the femur. We have the bone below, which is the tibia. When we talk about injuries, majority of the time it's a non-contact injury. We see it in a lot of cutting and pivoting sports. It's common in soccer, in basketball, and football. Essentially, we have the bone above and the bone below. The stabilizers are towards the middle of the knee or at the notch. We have the anterior cruciate ligament, which is the main stabilizer, and it controls back and forth as well as rotational stability about the knee. When there's a tear of the ACL, the knee moves out of sequence and we can actually damage the rubber shock absorber or the meniscus between the two bones. One of the reasons that we want to get the stability back to the knee is really to preserve that meniscus and to make sure that that repetitive twisting and shear doesn't cause tears. It can also damage the cartilage, and as the cartilage wears out, the knee starts to wear out and we have further problems. When we have somebody that has an ACL injury, we talk about different treatment options. We can work on rehabilitation. We can try to strengthen some of the muscles around the knee. Really, the hamstrings are some of the muscles in the back, and they're the friend of the ACL. So rehab protocols typically strengthen the hamstrings muscles. We can try braces to control some of the motion about the knee. But in young patients, a lot of times that really doesn't control all of the motion throughout the knee. And people that want to get back to activities that involve planting and twisting eventually end up undergoing ACL reconstructions. We have good success with ACL reconstructions. We're able to return athletes back to the level of competition that they were at before. The rehab after the ACL reconstruction is important because it does take a while before we allow the return to sport. Directly after the surgery, it's a large surgery. We use small incisions, but it's still a large surgery. And really, the high school athlete wants to take a week or two off of school. By about a month, they're walking pretty comfortably, and by 6 weeks, they're feeling really good, typically. That a lot of times is a danger zone for me because it really takes 6 months for those bone tunnels that we drill to incorporate in. And a lot of times, the athlete will feel like they can play basketball or football and they can stretch out their graft. So it's really important that we understand after an ACL reconstruction, it's going to be 6 months before we return to cutting and pivoting sports.